I am delighted. For those who don't know, you are an acupuncturist. And
Yes.
today I'm going to pick your brains all about acupuncture, which I'm really looking forward to. So tell me a little bit about you. Where are you in the world? Because we've never met before. So I'd love to kind of get a little bit of background before I sort of bombard you with a load of questions.
Fantastic. So I'm Chantal. My business is Dragonfly Acupuncture Leeds. So it kind of says that in the name. I am based in Leeds, West Yorkshire. I actually run a mobile practice. So I work slightly different to most acupuncturists that I just offer home visits only. So I travel out to all my patients and treat them in the comfort of their own home, which is just the best way to enjoy acupuncture, in my
Amazing.
opinion.
You're my first mobile acupuncturist that I've ever met. What a genius idea.
Well, because there aren't really that many acupuncturists that go mobile, because I think it's just the thing that when you become an acupuncturist, you think, oh, I have to work in a clinic. And most of them will work in the clinic. But for me, when I started practicing, that just wasn't feasible because I had 4 young children. And, the way to do it is working mobile. And, that was years ago. And I don't think there are that many, or there haven't been that many that actually work. It is.
And that's why I sent you a message saying that I really want to question you today about what is acupuncture. A lot of people, they know it as exactly what you're saying. You just stick the needle in and you just lie there and wait until something happens or not. But I wanted to pick your brains, about a little bit about what is acupuncture, how does it work, what are meridians? I mean, I'm bombarding you with a load of questions. Don't worry, I don't expect you to answer. Go. But let's begin by, sort of what is acupuncture? I mean, how would you explain it to somebody, an alien that's just arrived from another planet?
Well, the easy ways, it's just the insertion of needles on specific points on the body. We have 365 acupuncture points all over your body, and each point has their own reason why you would stick a pin in them, to have kind of an effect on the body. It really works on a holistic level. So it doesn't just treat physical ailments, but also emotional and mental and spiritual. It's a really good all-rounding treatment. And it's really an energy medicine. The Chinese believe that we have qi, which is our life force. It's almost like the invisible version of our blood. So we all know we have blood. It's coursing around our body, and we tend to only see it if we bleed, if we have a cut or anything. But we know it's there. Our chi is there, but it's invisible. We can't see it. But we know when our chi is depleted because we're not feeling very well. We have no energy, get pain, we get ill, we have low immunity, all these things. And chi flows around our body through the meridians, which are energy pathways. We have 12 meridians going up and down the body. And the way that I would explain the way that the meridians work is if we think about them as waterways. So you have rivers flowing, and through it is water flowing. So just like the chi is flowing through our meridians, water's flowing through the river. We've got the really big storms, like it's really windy up here in Leeds. It's throwing debris in the water. It's clogging up that river. The water gets stuck, so it becomes quite stagnant. Further upstream, there's no water. So the life that is in the river, fish and other microbes, they start to deteriorate because they haven't got the water, they haven't got the nourishment. The grass at the side starts to go brown because there isn't the water, there isn't the nourishment that they need. And it's the same with our energy. If something happens to our body, the energy becomes stuck. It's like that debris. And it's not just affecting locally, but it's affecting everywhere else in the body.
It's amazing that you mention rivers, because that's how I describe basically fascial lines and the fascia in the body as a clinical massage therapist. Sort of you're unblocking what I call the dams. And the dams are a collection of, it could be chemical reactions, it could be emotions, but if you consider that every single time you have an emotion, feeling, a trauma, physical trauma, even to the point of what you eat, affects the chemical reactions within your body. So I look at things very anatomically, but
Yeah.
also, sort of spiritually and energetically. I look at it very much based on, it's like we have a car, we have a battery. We don't question exactly how the electricity allows the car to function. We just know it happens. Kind of very much like the chi that you're talking about. We have that electricity within us. that just allows us to function. But sometimes we have a short circuit and it gets stuck.
Yeah. And then you need an electrician. With the acupuncture, we put a pin in and it releases that blockage. It does what it needs to do. So that's kind of a way that I would describe it.
Amazing. Now tell me a little bit about meridians, because with meridians, I'm aware, but not everybody is, that you have, the heart meridian, the kidney meridian, the liver meridian, and so on and so forth. But if you have blockages in those areas, one, what are meridians? And two, what does it mean? So if I said to you, somebody has a blockage in a liver meridian, does that mean that they have problems in their liver, for
Not
example?
necessarily. So in Chinese medicine, the organs important in Chinese medicine all are paired with a meridian. So like you say, you have the kidney meridian, the liver meridian, spleen, stomach, heart, gallbladder. All these bladders and all these organs have got their own functions. So they all have their role in the body. If there is a blockage in that channel. So, for example, the liver channel is blocked. The liver is associated with stress, anger, frustration. People get frustrated, they get angry, they get hot, start to get tension headaches, tight neck and shoulders, really irritable. It's the blockage in the liver channel.
Okay. And does that mean that if they don't unblock it, that they could eventually, in the long term, have a problem with the liver? I'm assuming.
No, so it doesn't mean that, if anything, like if I say to people, you've got a kidney yin deficiency, it doesn't mean that the kidneys aren't working properly. It just means from the Chinese medicine perspective, it's not functioning the way it's intended to function. Because you don't want to say to somebody, your heart hasn't got enough energy, because people are going to think, oh my God, but it's not. It's just that the way that it's intended to function in Chinese medicine, which is more about, it's not just blood circulation, it's not just about pumping things through your body. It's about really balancing our emotions and, really being a protector, but it doesn't mean that they're going to get a heart attack. So it's really about kind of having the Western hat, kind of hanging that to the side, because we always speak about things generally, I would say that I would speak from a Chinese medicine perspective. We can relate to the Western physiological processes, but just because you have a heart deficiency doesn't mean your heart in Western medicine isn't working.
What is it? I mean, for example, I've been to acupuncturists, and they always say, you're very damp, or you're very, there's different terminologies. What does that mean when they say, sort of you're damp, or you're dry, or you're, the different terms?
Yeah, so when you have your first appointment, we'll go through like a full consultation. And during that consultation, we try and see whether you are a dry person, or whether you're very cold or very hot or very damp. And we can pick that up by just the things that you tell us, but also by looking at the tongue and by feeling for your pulses. So, when we have, for example, when somebody's pulse is um very sluggish, but if we say it feels like pearls in a bowl, that kind of movement, it's a damp pulse. If somebody has a really thick coat on their tongue, there probably is a presence of damp. If your tongue is scalloped at the sides, it probably means it's swollen, which is, because it's the damp is gathering in the tongue. Somebody says, I have a lot of sinus problems, I have constant blocked nose, ear infections, my head feels really full of gunk. The chances are they're a very damp person, because it's the damp that is gathering, causing all these symptoms. And the damp could be, because the damp is such a great example, it could be because of the house that you live in being very damp and cold, and it could be the external environment. So it could be the weather. If you live out on the Yorkshire Moors where it's really foggy and misty for a lot of the time, that cold and that damp will penetrate, so that will affect your body. If you are somebody that eats a lot of white bread, white rice, white pastas, cheese, milk, yogurt, they're all very damp forming foods. So if that's your diet, you're bringing more damp into your body.
So I presume it's kind of like you can be a little bit damp, but you can be excessively damp in the sense that if you live in a damp place and you then eat that kind of food, and then I presume you have other factors, then you're just going to be like a soggy cloth.
Pretty much, yeah. And it's then to see how we can counteract it. So then with, treating with the acupuncture, we can then say, okay, we really need to look at warming the body and resolving the damp. And then you start looking at the things that you do beyond the pins. So there is a lot more to, acupuncture or being an acupuncturist. We look at the food energetics. So it's looking at, okay, so we know your diet is predominantly damp forming foods. Okay, let's look at actually the foods that you can have that are damp resolving.
Okay. So for example, if somebody's damp, what kind of food would you suggest for to help?
Green tea as a drink is very, very good because it resolves damp. Root vegetables, slow cooked, like pumpkin, sweet potatoes, squash, carrot, parsnips, turnips, just in chunks in the oven. You can put a little bit of fennel seeds on or cardamom, some nice warming seeds, maybe some cinnamon, a little sprinkle over it in the oven, slow roasting. It's great because it's quite soft and don't want to say mushy, but it's easy to digest for the
Mm.
body.
Yeah, it's kind of, I get the gist that it's kind of warm, cozy food.
So those are very, very good because it nourishes the spleen, which is the organ that is helping to resolve the damp, but it's also very affected by damp.
Okay. And if you have somebody who is very dry, for example, am I making the assumption that they should be having more cold salads and
I wouldn't necessarily go for cold. I would maybe go for just warming foods. It depends because there is a lot more to that. It's very rare that somebody in this country is very dry 'cause it
yeah.
tends to be the countries where it's very hot. So not that many people here are dry, but you would not necessarily go for cold foods, but cool or room temperature because you wouldn't really want to go cold and dry.
It's amazing how it interlinks. I had no idea. So tell me a little bit more, because there's the air and the earth and things like that.
Yeah, so you have different schools of acupuncture. So I train in traditional Chinese medicine, the TCM that we've been taught. A different school of it is five elements acupuncture, and it's really looking at the patient and it's what element do they fall under? Are they metal? Are they wood? Are they water? Are they fire? And it's really distinguishing where they are and which element is predominant in their, with the picture that they're presenting with. Because sometimes one organ can override the other. So if somebody's very, very cold, it could be that they're fire, but it's the water that's kind of overriding. But that's something that I am not, that's not my bag. I think the five elements, it's fascinating, but it's not what I practice. But it is very interesting to read up about, the Chinese acupuncture. You have Japanese acupuncture, you have the Korean hand acupuncture, you can have auricular acupuncture, so just on the ears. You have the cosmetic side of things, then you have your five elements. You have your medical acupuncture, you have your dry needling. There are so many different variables or variants of acupuncture, and they all have, their reasons why you would go for that one. And I think it's a very personal taste. I think it's not going to be for everybody to go and see a certain style of acupuncture. I think it's something that you need to give it a try and see what fits you best.
Absolutely. Yeah. I mean, it's thankfully we have such a beautiful range of different therapies that we can help thousands of people if they were to look for an alternative, which is fantastic. Now, when it comes to somebody coming in that has never had acupuncture before and they're terrified of needles, what would you
Yeah,
say?
I would say so just have a chat with somebody, have a chat with an acupuncturist nearby, just have a consultation, share with them your fears, what you're worried about. Most of us, we're so used to having people come in that are petrified of needles and, open up that conversation. It's the starting point, is take that step. Nobody's going to force you to go ahead with the treatment if you're not wanting to. But if you think, well, actually, it could really benefit, but I'm worried about the needles, I would still definitely give it a go. Go and see somebody. I very often will say to people, let's jump on a Zoom, let's have a conversation. I can show you the needles. I very often say, let's jump on a Zoom and I can show you what they're like. So these are like some of my needles.
So they're very thin. They're very, very, very small.
Yeah, so they're very thin. So generally, the needles are thinner than a strand of your hair. So they're incredibly fine. And really, they're about the same length as my index finger. And I think people very often have real misconceptions. So they are worried about needles because they're thinking they're going to be massive needles like the ones used at the doctors for injections or vaccination or taking blood. And actually, with one of these, if I had a needle that's used by nurses to take blood, I could probably fit about 16 to 18 of mine in one of those.
Wow. I didn't realize. Wow. That's amazing.
So they are incredibly fine. And whereas, a needle used to take blood is hollow, so it creates more of a microtrauma in the skin, so it's more painful. When with these ones, for one, they're silicone coated, most of them, so they glide into the skin. They're solid, so there's no hollow center in the needles. They just go in, they create less trauma. And very often when the needles come out, you don't even see where they've been. But what I say is, you are going to feel the needles go in because it's piercing the skin. It's it's piercing the skin, but it's not going to be something that is very long lasting. So the way that I very often explain it to my patients, like if I see somebody in like a home visit and there's partners and children and grandparents and whoever, like, oh, what's this? And I said, do you want to try a needle, see what it feels like, just so they have the experience. But I always say to them, the way that it is really the sensation is if when you remember when kids used to flick, like if you've got siblings, of like flick your skin
Yeah.
and you feel it for like a nanosecond. It's the shortest time, and then you don't feel it anymore.
So
It's the
yeah,
same with
it's
the
it's
same with
it's
the
a quick.
needles.
Yeah.
You're gonna feel it go in because I am sticking a pin in your skin, but then that's it. It shouldn't be painful. So it's really, if somebody's worried, it's talking them through this and say, this is what I'm using, this is how I'm going to do it, this is where the needles are going to go. If you have a back problem or a headache, it doesn't necessarily mean I'm going to stick needles all over your head if you've got migraines. Or if you've got your back going into spasm, doesn't mean I'm going to stick pins in your back. I can treat issues without being anywhere near the head or being anywhere on the back. And you're not going to look like a hedgehog or like a voodoo doll or a pinhead from Hellraiser. You might only have, 10 to 15 needles in.
Right.
And I think it's really, people have just the idea of acupuncture from what they've seen in films. They're either like being thrown the needles, or they're massive, or, they're being covered in hundreds of them. But, that's done because they want to create a scene in a film or in a program. It's not reality.
Not, yeah, it's not
And
the real thing. It's not what actually happens, which is kind of a disservice to you. The fact that, it's sort of that's what they promote. And then you're kind of trying to backtrack and say, no, 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 guys, this isn't it. You
yeah,
maybe 10 all over your entire body, during the whole treatment.
yeah. And I think that's why it's so important to do things like this and say, this is what's happening. This is what we do, and always have that conversation with people wherever, whenever, because it's important that people have the opportunity to ask questions and to find out, like, do I want to try this?
Fabulous. And tell me, how did you get into this? How long ago did you get into this?
I basically started out as a holistic therapist about 14 years ago. I did my reflexology, Swedish massage, aromatherapy. I did my holistic therapy, started working as a massage therapist or as a holistic therapist. At the same time, did my foundation degree in body work. So like you, it's covering a lot of massage styles, really treating the massage as a form of healthcare as opposed to something for relaxation. And part of that, we covered meridian therapy, we covered Ayurveda, we covered, deep tissue massage, myofascial release. We covered all that as part of the course. But we also covered acupressure. And I found that fascinating, the impact of pressing certain points, that it could have on the body was really interesting. And at the time, it was like, okay, what am I going to do when I finish my foundation degree? And really, I was looking for 1 year to finish to finish it as a degree, but there wasn't anything that I can just do in 1 year. And sometimes the universe throws these things at you that you need to be on a certain path. And I was being thrown things at me left, right, and center. And I was completely oblivious after about the fifth sign. And I was like, because all the signs were acupuncture. You need to do acupuncture. You need to do acupuncture. So I said, okay, I will go and be an acupuncturist. I'm going to work pain management, which was my interest at the time. I'm going to work in a multidisciplinary clinic with physios, chiropractors, osteopaths, that kind of thing. That was that
Pathway.
was the idea. That's what I was going to do. At the time, I was a single parent to two wonderful boys. In my second year, fell pregnant. And then found out at 12 weeks that it was twins. So that threw those plans out of the window. And I still wanted to carry on with my degree. Having just twin babies was not really going to stop me. So I guess when I was going to clubs with other twin mums or multiple mums to be, quite a lot of them had acupuncture alongside IVF to help them conceive. And I found that incredibly fascinating because that's really life changing. It's life changing to take somebody's pain away, or to take somebody's headaches away, or relieve their anxiety, that they're able to go out. That's amazing. Absolutely priceless. But to help somebody become a family, it's just amazing. So I did my dissertation on does acupuncture support IVF pregnancy rates, and it blooming did. There's a massive difference. So that kind of led me into like a different path that I wanted to be in. It's very much women's health. I had my twins 6 weeks into my final year, graduated with 8-month-old twins and a 6-year-old and a 9-year-old.
What a feat. That's
What
amazing.
a treat. And then kind of went into practice as a mobile therapist because I wasn't going to be able to start a clinic somewhere and being committed to being somewhere all day, probably a few days a week. I wanted to be with my babies. I wanted to be with the children. So yeah, mobile practice really worked best with managing my family. It was still me and my 4 kids. My family all live abroad. So it was just me and them. So we had to find something that made it work. And now, years later, I'm still working full time. It's very much a family led practice. So it's treating the whole family. I did my pediatric acupuncture because one of my girls, when she was born, had chronic constipation. And I really wanted to find out a way of how I could help her. So I did my pediatric training. So using acupressure, using acupuncture, using pediatric Chinese massage, tweener, using some gua sha, all these things. I was like, I need to help her. So now I can really go and see families, go into the home and treat mom and dad, treat grandma, granddad, treat the children. And it's really, it's really precious.
Amazing. What amazing story, Chantal. You're an inspiration. That's incredible. The drive, the determination, and the listening to the signs, because
Mm.
many times, the universe, he might as well put an arrow and even then we don't get it.
Well, I think that's probably what it was. I think there probably were a fair few arrows, and I was just completely oblivious. And then was like, okay, like somebody literally pushed it in my face. I'm like, oh, okay. Yes,
Yeah.
now I know the path I need to be on.
Honestly, what a beautiful, beautiful story. Love
Thank-
it. And when it comes to dealing with babies and children, sort of, can you deal with newborns and that kind of thing?
Any age, any age. So the youngest baby that I've treated was about 22 hours old. I was supposed to see mum for her pre-birth acupuncture session, but mum had had a very, very quick delivery the day before, and she messaged me and said, I've had the baby, so I don't need any pre-birth acupuncture, but I'd love just some postnatal nurturing. And obviously working mobile, it's perfect. You can just be in the bed feeding the baby, and I will just come and do my thing. And I think because she'd had a very, very quick delivery, baby was quite unsettled, and quite kind of refluxy and colicky, and very like curled up. And she said, oh, I don't suppose you could do anything for the little one. And I said, of course. And it's different when you are with children because children are so energetically susceptible that you don't need to leave. Like with adults, you leave the needles in about 20 minutes. With babies, it's literally in, little twiddle, and straight back out. So you don't have to worry about kids being laid still for 20 minutes.
Well,
It's a lot
they're
shorter.
they're so pure, they haven't, especially a newborn. It's I think the biggest shock is just the transition between being in that, sort of universe and coming here and suddenly
Yeah.
going, this is where I'm meant to be. And that's quite shocking for them in the first place. So the mere fact that you were able to deal with that child right at the time to kind of say, it's okay to be on this planet. It's okay to be in this world.
Yeah.
That's incredible. I didn't realize that you could work with newborns and
Yeah, absolutely.
adults.
Yeah, newborn, so anything from like colic, reflux, if there's any feeding issues for mum, you can help if the letdown reflex is not working, you can help stimulate the milk production, you can help with postnatal recovery. And I think when they're so little, very often if mum's unsettled because of whatever, it's affecting the baby. So by treating the mum, we are also treating the baby, but sometimes by treating the baby, we're also treating the parent.
Yeah. Yeah, it kind of well, it's that interlinked flow.
Interlinked. So it's just amazing, but it's amazing to just do a treatment and mum can be breastfeeding and I could just quick pin in and out. I remember seeing a lady a few years ago. I'd been seeing her for a prolapse. She'd been diagnosed with a prolapse. This was 5 months postpartum. Postpartum? What do we call it here? Postnatal. We're not in America. So I went to go and see her, and her mum was absolutely petrified of needles, but in a lot of chronic pain. And she said, you need to see my mum. And she'll come after the treatment. After her treatment, her mum would come. I said, okay. And I turned up that day, and actually the prolapse had lifted with the acupuncture. So what the prolapse was there before she had the first appointment, had a first appointment, went back, prolapse gone. Just like that. She could feel things shifting during the treatment. So I went to go see her. She said, there's no longer a prolapse, but let's work on strengthening. But I've had no sleep because little one was very unsettled. A little bit of a cough, quite chesty. I don't suppose you could treat him. And I said, yeah, it's fine. When you're laid with your pins in, because little one was just sat in a bouncy chair. So I'll just do some pins in little one. Dad was there as well. Such a really family healing experience. So I just sat with him and touched a few points. Just went on his leg, just with my fingers. Pressing the points, stimulating points, smiling at him. Talking to him, really interacting as much as you can with like a 5-month-old baby, and then put the needle in, twiddle that a little bit, took it back out again. Not a flinch. He was just giggling and laughing and cooing. At the same time, his grandma had walked in, who was absolutely petrified of needles, saw her 5-month-old grandson having acupuncture, not a flinch, and she was like, "Oh, well, if he's not bothered, neither will I." So it was just amazing. Kids are just fantastic, to teenagers, helping them with anxiety. I find that the younger kids that I treat tend to be for like allergies like asthma, eczema, or any digestive issues. Like constipation's a big one. And then kind of 8+, it all tends to be like anxiety related most of the time, like stress related, so like tension headaches. But it's just amazing. Like kids really, really love acupuncture. They absolutely love that.
Interesting, isn't it? And what I find, just to wrap today's chat, I always wanted to bring out information about alternative health because the medical industry are not that, sort of comfortable with embracing alternative health. But I find that they embrace acupuncture, and that's really interesting that they are willing to put aside their lack of knowledge, their beliefs, to embrace a completely alternative method.
And I think more and more people are going for it. There's a lot more, I think, positive stories in the news. Some celebrities are doing it. It's different ranges. Sometimes it's sports people. I know Kim Kardashian did it. She's had it a few times, like Katy Perry, Lucy Liu, all these people. What's the other one called? Cameron Diaz. They've all had acupuncture.
I think that by making it more mainstream, the medical industry have kind of accepted it.
I don't know necessarily whether it's impacting that way. I think it's more because they're seeing the results. I think people are often coming to us as a last resort. They're like, oh, I've tried everything else but the kitchen sink and acupuncture. I don't really want to try the kitchen sink, so try acupuncture. And I say to you, like, I don't really know what it's going to do. You're the last resort. Don't know what's going to happen. I've been trying everything for years. Sometimes it's 10, 20, 30 years that somebody's been struggling. You
That's a
see them the first time
issue.
and
Yeah.
they're crippled, and you walk away and they're walking normally. Like a lady that I saw on Monday, you couldn't touch her because she was in so much pain. She
Mm.
was limping, she was kind of hobbled over, she wasn't comfortable, she kept moving because she was in pain. Did the treatments, she got up off the couch and she's like, oh my God, I feel like a new woman. The pain was all gone. And in places where I'd just been touching to put the needle in, even that light touch was too much. And she was she was proper poking her legs and her arms, no pain. But she'd been suffering for about 25 years, and she was like, there's nothing there.
Yeah.
There's no pain.
Yeah. So the doctors can't really argue it, sort of they go back to the doctor and say, I'm off my painkillers. How
Yeah.
yeah, I did acupuncture.
Yeah, and that's how it's going. People will report back to their GP or their consultant and say, "Oh, I've been having acupuncture." A lot of the fertility clinics will now work with acupuncturists because they can see the importance of actually, having acupuncture alongside can make such a huge difference to live pregnancy rates that they see there's a real value in recommending acupuncture.
Well, it's wonderful to meet somebody as passionate about their work as I am. So thank you so much for reaching
My
out.
pleasure.
Tell me, if somebody's in Lead, how can they find you? Where can they look you up?
Probably the easiest way is to just find me on Facebook. It's Dragonfly Acupuncture Leads, or my website is www.dragonflyacupunctureleads.com. And I cover Leeds well, I cover East Leeds, but I cover a half an hour radius from where I am. So it takes me to the outskirts of Leeds as well. So I would say, like, if anybody is in this area and wants to know more, or people wants to do some acupressure sessions online, they can get in touch with me the same way. Or if they need a recommendation for a trusted acupuncturist in their area, if they wanted to message me and say, I live in Essex, who can you recommend? Because we are an amazing bunch of people and we're all like out here making a difference, one needle at a time. And there are so many amazing acupuncturists that I can recommend all over the UK and actually all over the world, to be honest. Fantastic. Thank you very much.
All right. Thank you so much.
Take care.
Bye.